jungle.
Hello everyone, in this video we are going to talk about spinal nerves. The spinal nerves are mixed peripheral nerves that carry motor signals to all muscles of the body and sensory information from all parts of the body to the central nervous system. Now, what do we mean by mixed peripheral nerve? Mixed peripheral nerve means that they contain both motor and sensory nerves. And when we say peripheral, we mean that they are located outside the central nervous system. They are not inside the brain and not inside the spinal cord. So they are located outside the central nervous system. That is why they are called peripheral nerves. So there is one thing I want to remind you, that in the vertebral column, which is the backbone, in the vertebral column, remember we have 7 cervical vertebra, we have 12 thoracic vertebra, we have 5 lumbar vertebra, we have 5 sacral vertebra, and we have 4 coccygeal vertebra, making it a total of 33 vertebra in the spine, a total of 33. But the case is different in the spinal nerves. In the spinal nerves, in the cervical region, we have 8 pairs of spinal nerves. In the thoracic region, we have 12 pairs of spinal nerve. In the lumbar region, we have 5 pairs of spinal nerve. In the sacral region, we have 5 pairs of spinal nerve. And in the coccygeal region, we have just 1 pair of spinal nerve. But our focus now is in the cervical spinal nerve. Why do we have 8 spinal nerves and we have just 7 spinal vertebra? We have just 7 spine vertebra in the cervical region. The reason is because, let us assume that this is C1. This is C1 cervical spinal vertebra, and this is C2, C3, C4, C5, C6, C7, C7. So now, the first spinal nerve in the cervical region emerged from above C1. The second spinal nerve emerged from above C2, and it continues like that until it gets to C7. But how do we get the 8th spinal nerve in the cervical region? It is because the 8th spinal nerve emerged from below C7. So that is why from the thoracic region down to the coccygeal region, each of the spinal nerve emerged from below their corresponding spinal vertebra. So when you have T1, the spinal nerve T1 emerged from below T1 spinal vertebra. T2 emerged from below T2, T3 emerged from below T3, and it continues like that. But then there are 4 plexus in the spinal nerves that I want you to know. 4 plexus in the spinal nerve. The plexus in the spinal nerves are a bundle of nerves. The first plexus in the spinal nerve originates from C1, C2, C3, and C4. So these 4 spinal nerves form a bundle, although there is a minor contribution from C5 in the first bundle of nerve. This bundle of nerve that comes together is known as the cervical plexus. This cervical plexus is the bundle of nerve that supplies or innervates the back of the head, the back of our head, the neck region, and the shoulder, region. So the cervical plexus supplies the posterior part of the head, the neck region, and the upper part of the shoulder. There is one important nerve in the cervical plexus that I want you to remember. It is known as the phrenic nerve is known as the phrenic nerve. The origin of the phrenic nerve originates from C3, C4, and C5. But the major nerve that gave rise to the phrenic nerve, the major nerve that has the largest contribution in the phrenic nerve, is C4. So that is why, as a clinical student, you walk towards a patient and they told you that this patient has spinal cord injury, and you were also told that the patient has respiratory complication. What does that tell you? There is a trauma that happened to the cervical region, and the particular nerve affected is the C4 or C5 or C3. But majorly, the damage must have happened to C4. That is why respiratory system is affected. This is because the phrenic nerve supplies the primary muscle of respiration, which is the diaphragm. So whenever phrenic nerve is affected, such individual or patient will have respiratory complication. Now, the next bundle of nerve that you need to know is the one that has its origin from C5, C6, C7, C8, and T1. From C5 to T1 form another bundle of nerve. From C5 to T1 form another bundle of nerve known as the brachial plexus. The brachial plexus is the bundle of nerves that supplies the upper limb. The brachial plexus is the bundle of nerve that supplies the upper limb. But then there are some important nerves in the brachial plexus that I want you to know. Those nerves include the radial nerve. The radial nerve is the nerve that is located at the side of the forearm where you have the radial bone. And we also have the medial nerve. The medial nerve is located in the middle of the hand. And we also have the ulnar nerve. The ulnar nerve is located at the side of the hand where you have the ulnar bone. But then I want you to remember that the medial nerve, when it is compressed or when there is a damage to the medial nerve, it causes a medical condition known as carpal tunnel syndrome. So when the medial nerve is compressed or when there is repetitive movement that happens to compress the medial nerve, any trauma, any damage to the medial nerve causes carpal tunnel syndrome. So that is why the index finger, the ring finger, and the middle finger will be affected. So this person will not be able to open and close their hands very well. The grip strength will be poor. So the next bundle of nerve making the next plexus in the spinal nerve is from L1, L2, L3, and L4. These four nerves form the next bundle of nerve. And this next bundle of nerve is known as the lumbar plexus. The lumbar plexus. This lumbar plexus is the bundle of nerve that supplies the anterior part of your thigh, where you have the quadricep muscles, the lateral part of the thigh, and the middle part of the thigh. So when this bundle of nerve, when there is a trauma to this bundle of nerve, the person's gait, the way the person walk will be affected. There is one important nerve in the lumbar plexus that I want you to remember. It is known as the femoral nerve. This is one important nerve in the lumbar plexus I want to remember. So the next bundle of nerve is the one that have its origin from L4, L5, S1, S2, S3, and S4. This bundle of nerve from L4 to S4 form another bundle of nerve known as the sacral plexus, known as the sacral plexus. The sacral plexus is the bundle of nerve that supplies the posterior part of the thigh, the perineal region, the legs and the foot. The legs and the foot. But then there is also another important nerve in the sacral plexus that I want you to remember. In the sacral plexus, there is another important nerve, although this nerve has its origin from both the lumbar plexus and the sacral plexus. So from L4 to L5 to S1, S2, S3, from L4 to S3 form a particular nerve known as the sciatic nerve. This sciatic nerve is the largest nerve in the human body. So the sciatic nerves got its origin from the lumbar region and sacral region. So that is why the origin of the sciatic nerve is from the lumbosacral plexus. This sciatic nerve, some persons who are not professionals, when they give injection in the wrong quadrant in the gluteal muscle, it damages the sciatic nerve in most cases when the person is not professional. And when the sciatic nerve is damaged, it causes a medical condition known as foot drop, a situation where the person will not be able to dorsiflex their ankle. They will not be able to dorsiflex their ankle. The sciatic nerve has two major divisions. The sciatic nerve bifurcates into the tibial nerve that supplies the posterior part of the leg and the common peroneal nerve or common fibular nerve that supplies the anterior part of the legs. Now, when the sciatic nerve is damaged or there is a trauma to the sciatic nerve, in most cases, these patients come down with foot drop. The reason is because the common peroneal nerve or the common fibular nerve, which is the second branch of the sciatic nerve, is thinner compared to the tibial nerve. The tibial nerve that supplies the posterior part of the leg is thicker, is bigger, and the common peroneal nerve is thinner. So when the sciatic nerve is affected, when there's a trauma to the sciatic nerve, the common peroneal nerve or common fibular nerve is majorly affected. Now, from T2 to T12, spinal nerve T2 to T12, where do these nerves innervate? Does spinal nerve T2 to T12, where do they innervate? From T2 to T3, T4, down to T12, they innervate the intercostal muscles and the abdominal muscles. If this video helps you, please help subscribe, comment, like, and share with your friends. Thank you.